关上门，谢谢。
Undertreatment in sickle cell disease, SCD. Undertreatment in sickle cell disease, SCD, refers to inadequate management of the disease, resulting in preventable pain, complications, and reduced quality of life. People with SCD often experience undertreatment due to several systemic issues. Pain management. One of the most common issues is inadequate pain management during a sickle cell crisis. Patients frequently experience severe pain, but stigma, misconceptions, and concerns about opioid use can lead to suboptimal pain control. This results in patients suffering unnecessarily as their pain is not adequately addressed, which can lead to repeated hospitalizations and deteriorating health. Access to specialized care. Individuals with SCD may lack access to hematologists or specialists familiar with the disease's complexity. Limited access to comprehensive SCD care, particularly in rural or underserved areas, often leads to patients receiving less effective or less frequent interventions. Preventive treatment. Preventive treatments like hydroxyurea and, in some cases, blood transfusions are proven to reduce the frequency and severity of pain crises and other complications. However, many patients are not prescribed these medications due to lack of awareness or access. Regular monitoring for potential complications, such as stroke or organ damage, may also be underused, which increases the risk of severe, irreversible outcomes. Delayed intervention for complications. Many SCD complications, like acute chest syndrome or stroke, require immediate treatment to prevent serious sequelae. Delays or undertreatment in emergency care settings can lead to worsening of these complications. Lack of prompt and effective management contributes to a higher risk of hospitalization, organ damage, and mortality. Systemic barriers. Racial and socioeconomic disparities often affect SCD treatment, as the disease predominantly affects individuals of African descent. Patients may encounter bias in healthcare settings, leading to less aggressive treatment compared to other chronic conditions. Consequences of undertreatment and how to address undertreatment. Consequences of undertreatment. Undertreatment can lead to more frequent pain episodes, higher complication rates, and increased mortality. It also results in significant physical, psychological, and economic burdens on patients and their families. Addressing undertreatment. Improving treatment for SCD requires increasing access to specialized care, education of healthcare providers on SCD management, implementing comprehensive pain management, and reducing biases in care. The nurse's role in advocating for patients with SCD. The nurse's role in advocating for patients with SCD is critical in addressing undertreatment and improving care outcomes. 1. Advocate for equitable care. Recognize biases. Address and challenge implicit biases within healthcare systems that may affect SCD patients, especially around pain management. Cultural competence. Ensure culturally sensitive care by understanding the diverse backgrounds of SCD patients. Speak up. Advocate for equitable access to treatments like hydroxyurea, blood transfusions, and emerging gene therapies. 2. Promote comprehensive pain management. Assess thoroughly. Use validated pain scales to assess pain accurately, believing patients' reports of pain without judgment. Individualized care. Work with the healthcare team to develop personalized pain management plans that combine pharmacologic and non-pharmacologic strategies. Educate patients. Empower patients with self-management strategies, including hydration, avoiding triggers, and recognizing early signs of vaso-occlusive crises. 3. Enhance access to specialized care. Referral coordination. Facilitate referrals to hematologists, genetic counselors, or pain specialists when needed. Telehealth advocacy. Advocate for telehealth services to provide care to those in rural or underserved areas. Community resources. Connect patients with support groups, SCD foundations, or financial assistance programs. 4. Provide education to patients and families. Disease understanding. Teach patients and families about SCD triggers, prevention strategies, and treatment options. Medication adherence. Promote adherence to prescribed therapies, explaining benefits and addressing misconceptions. Emergency preparedness. Ensure patients understand when to seek urgent care during crises. 5. Educate and collaborate with healthcare teams. Training initiatives. Advocate for and participate in educating colleagues on SCD pathophysiology, crisis management, and addressing stigma. Policy advocacy. Work with leadership to develop protocols for timely pain management and crisis care. Interdisciplinary collaboration. Partner with social workers, case managers, and patient advocates to streamline holistic care. 6. Policy and public advocacy. Raise awareness. Participate in community and legislative advocacy efforts to highlight the needs of SCD patients. Support research. Advocate for funding into SCD research and new treatment modalities. Legislation. Promote policies that increase access to specialized care, improve pain management guidelines, and address health inequities. Nurses, as trusted patient advocates, play a pivotal role in improving care for individuals with SCD by combining direct patient care with systemic advocacy to create a more equitable and effective healthcare environment.